Do you mind walking us through some of the toughest ethical decisions that care partners may face?
Well, I don't know about the toughest, but the most common issue that arises in a dementia patient approaching end stage concerns feeding them food and giving them water to drink. It's pretty commonly the case that patients might lose their ability to coordinate their swallow, so they don't eat and drink well. We see many patients who decide to eat less in the last months or even years of their life. And so the question of feeding and should we put potentially tubes down somebody's throat or through their stomach to give them more nutrition when they're not taking in enough is something that we often feel might help patients. It might make them live longer. That's what our intuition would tell us. But studies have shown quite conclusively that if we feed people in end-stage dementia by tube, it doesn't make them live longer or live better or improve their nutritional status or any of the things that we think that it might do.
Really?
Rather, the evidence shows that feeding compassionately by hand in a comfort way, as much as a patient can take, taking their cues according to whether they're enjoying food or not, is just as likely to give them as long and as good a life as feeding by tube. So that's something that can be difficult for families to accept when they see their loved ones not eating enough. But it's almost always the case that compassionate hand feeding is a better option than tube feeding.
I didn't know that. Can you tell us about another?
Well, another thing that might come up at the end is whether it makes sense for somebody, once their breathing becomes labored, to go to an intensive care unit. People who see that their loved one might be passing away, if they're somewhat desperate, they want to save their loved one, they don't want them to die today. And the thing is that intensive care units can often prevent somebody from dying today. But what we know is that when you have reached the end stages of illness, an intensive care unit and the respirator, the breathing support that it gives, will not likely help you. It will prolong an unconscious existence. And so for the vast majority of people who understand that the end may be coming, they would not see a respirator as something that would help somebody who's expiring due to end-stage dementia.
What other decisions might be faced?
Another technology that can save many lives is kidney dialysis. Kidney failure is something that can happen for a number of reasons. It might be a response to a medication or other things going on in the body. And many patients can have their kidneys replaced through dialysis machines. But dialysis, if one needs it, is not necessarily a simple treatment. It's fairly invasive, where one has to go 3 times a week and be plugged in with catheters to a big machine that basically exchanges your blood and does the job of the kidneys. But people will report that they're very tired, that it takes a lot out of them. And just like other interventions, as somebody is approaching death, possibly in the next days or weeks, it may well occur to them that dialysis is not improving their quality of life. It's draining them out, wiping them out. And so some will decide that dialysis isn't something they want.
What is your thinking about resuscitation?
Well, resuscitation is one of those things in the modern hospital where, for good reason, we want to have this idea that if anybody is found to be not breathing or their heart not beating, or we want to bring them back to life if we can, and that makes sense. CPR, the idea of helping somebody's blood flow by pounding on their heart and giving them some oxygen through their mouth, we know can keep people alive who might otherwise be dying. But the problem is that when people are dying in a predictable way from a disease that seems to be potentially taking their life in the near future, the logic of resuscitation falls apart If somebody is succumbing to a terminal illness in a predictable way, most physicians and caregivers are not comfortable with the violent act of resuscitation, which for such people means that they probably might get a heartbeat back only to die again later today or tomorrow. So Alzheimer's disease in its late stages is a terminal illness, and very rarely would it make sense if somebody succumbs to Alzheimer's as a part of the predictable course of the disease. Very rarely would it make sense that resuscitation would be a favor to that person. So we need to use resuscitation wisely, which is to try to prevent the death of people who were not expected to die.
Thank you for those insights. What sort of issues arise out of pain control?
Well, like anybody who is in a state of advanced illness, we would want to pay very close attention to whether they're in pain. We obviously don't want patients to be in pain, but sometimes treating their pain can decrease cognition even more, that people who are already in advanced dementia are even perpetually asleep or not able to interact at all. So we worry sometimes about too much pain medication. But I think it's important that if we have reason to believe that somebody's experiencing pain, that we pay attention to that, be aware if there could be any bone or muscle problems that might be causing discomfort for the patient, and ensuring that all signs of pain are listened to and that it's well treated.
You've given us a lot to think about. How indeed do people with Alzheimer's tend to die?
Well, it's a really good question, because the disease, we know, causes the brain to deteriorate. We've seen pictures of how the brain shrinks and parts of it almost disappear. Yeah. So that in and of itself doesn't tend to kill people, but it's the effects of where is the deterioration in the brain happening and what body systems are affected. Mm-hmm. So very often we see Alzheimer's patients lose their ability to swallow, because swallowing is a very complex, coordinated movement, and if the area of the brain that controls that is deteriorating, the swallow just doesn't work. So in that case, over time, a patient might not get enough nutrition because it's uncomfortable to eat, and that can lead to an imbalance, which can lead to a heart event or something. So it's usually the effects of Alzheimer's cause an organ system in the body to fail, and that's usually what would lead to a death.
We've all heard people talk about a good death. How would you define a good death?
Well, of course, death is often sad, but we know that deaths can be made worse if we apply medical technology thoughtlessly. Mm-hmm. The age of modern medicine has made us realize and confront the fact that if we don't think about what we're doing, we can make people's deaths worse by applying technology which is very unlikely to help. I think that a good death is probably similar for most people now as it was in the past, which is surrounded by family, with expressions of love, being told that they'll be missed and remembered. I think that's the ideal death, a peaceful, calm scene where love is in the room. One of the things that can happen if we don't plan for a death is that it can be moments surrounded by the frenzy of being poked and prodded, and those can be a person's last memories as they pass away. And we want to recognize that patients who are dying should not be almost assaulted out of some blind hope that we might rescue them. I think most people want a peaceful death, and that's what we should try to achieve.
Before we wrap this up, do you have any other advice for care partners?
Know the goals, and to know that as the illness progresses, the goals will progress from very aggressive treatment early on to an understanding that if this illness is progressing to end stage, we need to focus on comfort, making the life as pleasant as it could be, and not simply throwing technology at a patient. What they need is hand-holding and caregiving, not technical interventions. And that's usually what turns a death into a good death.
This has given me so much to think about, Gary. I can't thank you enough for sharing.
Hopefully some of these ideas are helpful.
It sure is. Thank you.